While both type 1 diabetes and type 2 diabetes involve issues with blood glucose, they are very different diseases. Let's take a look at some of the key differences. Difference number 1. Risk factors. While it's true that type 1 and type 2 both have a genetic factor, type 2 diabetes also has the following risk factors: being overweight, eating an unhealthy diet, smoking, and being inactive. Difference number 2. Occurrence. Type 1 diabetes typically occurs early in life and it develops suddenly. Type 2 diabetes, however, typically occurs later in life and it develops slowly over time. Type 2 diabetes is much more common than type 1. Worldwide, about 90 to 95% of the cases of diabetes are type 2 diabetes. Difference number 3. Classification. Type 1 is classified as an autoimmune disease. Type 1 diabetes occurs when the body's immune system attacks the islet beta cells in the pancreas. The beta cells are responsible for making insulin, so when the immune system destroys these cells, the body is no longer able to produce insulin. Type 2 is classified as a metabolic disease. Type 2 diabetes occurs when the body becomes more resistant to insulin and when the pancreas makes less insulin than it used to. These effects are directly related to having too much body fat. Difference number 4. Insulin within the body. Type 1 diabetics cannot make any of their own insulin. They require an outside source of insulin. This is why people with type 1 diabetes are considered insulin dependent. Type 2 diabetics can still make some insulin. However, they cannot efficiently use the insulin made by the body. This is why people with type 2 diabetes are considered insulin resistant. Difference number 5. Medication. Type 1 diabetes requires injectable insulin through a pump or syringe because the body can no longer make its own insulin. Type 2 diabetes, however, is often controlled with medication in pill form, and type 2 diabetics sometimes take injectable insulin as well. Difference number 6. Curability. Type 1 diabetes, unfortunately, has no cure at this time. Type 2 diabetes cannot technically be cured. However, it can go into remission with exercise and dietary changes. So, as you can see, despite having some basic similarities, type 1 and type 2 diabetes are very different diseases. For the signs and symptoms common to both types of diabetes, see the video linked in the description.